Hello everyone, this is Dr. Lori Langdon with a personal account of my recent COVID infection. I think all of us have been trying to do our best. I have been exceptionally careful trying to avoid this dread virus, and it's sort of this cosmic game of dodgeball. You found out about an exposure, you tested, and you hoped you didn't get it, and you didn't, and we just keep going and going, and finally it got me. I think it was a patient. The timeline would be right. We know right now circulating we have a lot of Omicron, and Omicron is extremely contagious. It continues to mutate, which makes things tricky. There is discussion that hopefully this fall we'll have an Omicron specific vaccine, but that should not make you get your recommended booster. So we still want you to get your recommended boosters. Even if there's a more specific vaccine coming, the boosters are still continuing to show efficacy against hospitalization and death. So I just thought I would share with you guys where I am on my recent infection. Depending on if you start the very first day of symptoms as counting it as 0 or day 1, I am on day 10 or 11 of infection now, and I'm doing much, much better. I also wanted to just share with you, this isn't even so much medical advice, it's just personal advice, what worked for me. Mine started as a severe sore throat. I mean, severe. It hurt to swallow, but I was completely fine otherwise. And one of my kids had a sore throat earlier in the week and tested negative for COVID, so I just assumed it was her sore throat. So to begin with, I just used a whole lot of sore throat spray. You'll notice a theme here. We really love generics in our family, and sore throat spray for adults or older kids who can tolerate the taste, it works great. It really numbs it for just a minute. You can get on with your day. I also started kicking in with some hot tea. Now, this is my favorite mug, a gift from a friend, and yes, I do appreciate the humor. And then another friend introduced me to my now favorite flavor of tea. And so I did a lot of hot tea in my mug. If you will stir some honey in with that, it works extra well. So I enjoyed that. I remember that week, that was a Thursday and Friday. I still worked. I even had a resident in my clinic that was shadowing, working with me that Friday. And then Saturday morning when I got up, I actually felt a little bit worse. So I started taking some ibuprofen that morning. I forgot to bring that as a visual aid. I have a big jug of Equate ibuprofen. And then that day I thought, well, gosh, I feel like I'm sicker than my daughter was with her sore throat. So as soon as I got home from that half day of work Saturday morning, I went ahead and tested myself with the at-home, I think the brand we had was Binax, and it was a highly positive test. So it's the 2 stripes, and my test stripe was super, 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 super bright. So obviously then everything stopped. I called everyone I had worked with that week because around patients, I'm always wearing a mask. But, you know, in the break room eating lunch, maybe I wasn't, maybe I could have exposed them. So I let the front office staff know and my nursing staff know and the resident that worked with me. And I felt terrible that I had potentially exposed them and not realized it. We had even gone out to eat the night before. I felt so bad. So I let that couple know that I had tested positive. Fortunately, to this point, which we're now way past that point, no one has developed symptoms, which is pretty incredible. So I wanted to share that part too of how I helped my family not catch it. So when I was in the house, I just tried to stay in my bedroom. We have an attached bathroom, and my precious husband would just bring me food if he had cooked it. And at the beginning, I still had taste and smell. I lost it, and it's sort of partially coming back now. So if I stepped out of the bedroom, I always wore my mask, right? And that's really important. This is the same kind of mask I would have had on though when I was around the patient, and obviously it wasn't protection enough for me to not catch it, but I was hoping it would at least be enough to prevent my large respiratory droplet spread to my family. And obviously I didn't step outside the bedroom if I was in the middle of blowing my nose or coughing or anything like that. And oh my goodness, I have used hand sanitizer out the wazoo constantly. Every time I blow my nose, if I had cough, before I touch anything that somebody else might touch. And knock on wood, thank goodness nobody in my family has caught this so far. And we're almost out of the woods now, which is fantastic. Other things that I love to use, I like Vicks Vapor Rub. This is the generic, obviously, just on the chest or under the nose. I use cough drops because I had to go back to work on day. So I notified employee health. We're allowed to go back if you start day, the very first day of symptoms is day 0. Then you count 0, 1, 2, 3, 4, 5. You can go back on day 6. For me, the office was closed that day anyway, and I got an extra day because of the 4th of July, which worked out great. And so then after that extra rest day, day 6, I went back on day 7. So I love cough drops. I'll put those in my mouth before I go into patients. And now that I knew I was positive, even though, I was following all the rules and went back after day 6, I always now, if I'm around any staff for the whole full 10 days of my infection, and obviously before I go in with patients, I use N95. So these are not nearly as comfortable as the regular surgical mask, but I have been using them when I'm in with patients or with staff in my individual office, which, as you can imagine, gets very tricky. So that's part of what I wanted to emphasize with you guys is, the current CDC guidelines are you have to be in complete isolation for the first 5 days, but then you're allowed to go back for the second 5 days if you are masked. But a lot of people forget, maybe they wear their mask some of the time, but they go to the break room and eat lunch with everybody else and take their mask off. That doesn't count, guys. You have to really wear your mask the whole time. And then let me introduce you to the really big champion of this COVID infection, and that was generic Nyquil. Now, I have high blood pressure, so I can't use things with decongestants in them, but Nyquil only has Tylenol, an antihistamine, and a cough suppressant, dextromethorphan, which is the same cough suppressant in every prescription and over-the-counter cough medicine. And it's got a whole lot of alcohol. Now, I am Baptist and do not drink very much, an occasional social drink perhaps, but the alcohol apparently knocks me out. So it's a good thing I'm not a big drinker, I guess. Or maybe I would be more tolerant if I were, I don't know. But this was effective in many ways. It helped me get sleep, and that's important because your immune system needs the rest to be able to fight things off. It tasted nasty though. Even when I did lose my taste, how ironic is this? I could still taste this nasty stuff all the way down, but it seemed to like burn a hole through the mucus in the back of my throat. So I'd highly recommend NyQuil. Now, another quick thing just to tell you guys about, because it was a learning experience for me, and that is, it turns out, in retrospect, I would have qualified for the current emergency use authorization antivirals Paxlovid. It's a combination of 2 meds that are basically protease inhibitors. That is, it decreases the replication of the virus. So it can help decrease your risk for hospitalization and death if you're considered at high risk for progression of disease. Now, I was thinking in my mind, high risk would be really old, really frail, really sick type people. But when you look at what's published by the FDA under their EUA, it says anybody over 60, I'm not quite there yet, not terribly far away, anybody with hypertension, I do have hypertension, and anybody with a BMI greater than 25, that's not that high by today's U.S. standards, guys. I'm 4'11", so my BMI calculation stinks, and I would have to be basically 98 pounds to be in the healthy range. So anyway, I would have qualified for this antiviral if I had stayed up on my adult recommendations. I promise you I try to stay up to speed on all the peds recommendations. And by the way, if children are greater than 12 years old and greater than 40 kilograms, which is around 88 pounds, and have a risk factor like hypertension, asthma, chronic immunosuppressive therapy, any kind of condition that does suppress their immune system, obesity, or any of these things, then they could also qualify for Paxlovid. So I knew about pediatric, but I didn't know about adults that I actually qualified for those risk groups. So I guess I should have called my primary care provider to get some of that stuff. I didn't, and I am fine, thank goodness. But I just wanted to remind you guys, especially if you're adults. Now, if anybody's over than 60, even if they don't have the risk factors, they can also qualify for getting that EUA antiviral medication. I hope this was helpful, guys. One more tiny tip is I always insist on using tissues that have the added lotion. And my nose is still pink and irritated, but it would have probably been raw if I'd been using those hard, cheap tissues. And so I like Puffs Plus. There's also Kleenex Cold Care and probably generics in that. I don't know, but I really like Puffs Plus. And it's funny because my husband's very frugal like Dave Ramsey, but he allows me to splurge on Puffs Plus because that's really important not to get a raw nose when you're already feeling so crummy. So I hope you guys continue to dodge this virus. It was no fun. Initially that day I started feeling crummy. Fever went up to 102.7. I had some chills. Didn't really feel like eating, just really exhausted, nasty, persistent, wet, productive cough, facial pressure, blah. Just like a really severe cold or flu, kind of achy, and the fever makes you feel crummy anyway. So it was no fun. Wouldn't want to do it again. 0 out of 10. Wouldn't recommend it. So I would encourage you guys, remember that the numbers are actually returning to being high lately, and I think all of us have had pandemic fatigue and haven't been as meticulous about wearing masks in crowded indoor places and things like that, and we probably should do that because it's really no fun to get this. And you don't want to have that horrible feeling I had of thinking, oh no, now I've got it, and what if I accidentally passed it on before I realized I had it? So I'd encourage you guys to remain careful out there, and I hope you found some of my personal experiences helpful. Thanks.